Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. Hey everyone, welcome to Cracking Cancer. I am your host, Dr. Kyle Concannon, and I am joined today with cancer patients, JJ Singleton and Bill Phillips. And we're here talking about how men uniquely experience cancer. So maybe starting off, we could just introduce ourselves. I'm a physician scientist at MD Anderson Cancer Center, and I treat mostly thoracic oncology patients. JJ, tell us a little bit about yourself.
Yes, I'm JJ Singleton from near Asheville, North Carolina. I was diagnosed with colorectal cancer almost 10 years ago now in September of 2015.
All right. Bill, how about you?
Yeah, Bill Phillips. I live in the DC area in Arlington, Virginia, and I was diagnosed with colorectal cancer just about 2 years ago in April of 2023.
Wow, it's very recent. And you're also founder of KFG Project. I see the sign behind you.
Oh, yeah. Keep effing going. One of those hashtags that myself, fellow patients, and my network friends were all texting to each other what I was getting of, next thing, just keep going. So yeah, started a nonprofit and it seemed like a perfect name.
Sounds good to me. Well, thank you both for joining us. I think you're great people to come on and talk about how men may uniquely experience cancer. The ways we cope with cancer can be different. Social communities can be different. So I think a lot of people will be able to learn a lot from your experience and Bill, the initiatives that you've set forward to try to meet those needs and help folks. Kicking us off, I want to hear first your sentiments about experiencing cancer initially. So maybe starting with JJ, can you take us back to that moment when you were first diagnosed? What emotions hit you? What were your first steps? Tell us about that.
Yeah, when I was first diagnosed, as I said, I was 27, so I was in like a world of unknown because I didn't think colorectal cancer was possible at my age. Only thing I'd ever heard about it was my grandpa's disease. So I went from unknown to straight into fear because, again, like most of my family had never really dealt with cancer internally there. So it was like, well, only thing I remember is seeing TV shows and movies where you get cancer and you die. So it was the fear, and then it was just the stress of everything and like the overwhelming burden that it was going to cause.
Yeah, that sounds pretty overwhelming. How did you navigate that? Did you talk to people in the beginning or keep to yourself?
Yeah. In the beginning, I didn't talk to anybody. Like, I didn't want to scare people. I didn't want to burden people. I would give my medical updates kind of online because I got tired of writing the same thing down 100 times or in a text message or a phone call. And that was all I ever really said about it at first. I kept everything internalized because I thought I would be able to handle it. I thought I was, a strong young person that was able to deal with anything. Because in my life leading up to that, I had made it through all the obstacles, the ups and downs of what I considered normal life. So I was like, why is cancer going to be different? Quickly found out that it was different, but it took me a lot longer to realize that I needed to talk about it and I needed other people to help me process and deal with everything that I was going through.
Yeah, that makes a lot of sense. And having had many opportunities to speak with you about it, you've navigated this in a really impressive way. I'm looking forward to hearing more. Bill, what was your initial diagnosis like? What were those emotions? How did you handle them?
Yeah, it was a shock. So I had seen very minor symptoms, a little bit of blood where it shouldn't have been, and told my doctor. So I was just on the heels of a 20-year career in the Navy, flying jets, working at the Pentagon, and getting approved to retire. And, the symptoms were minor. I had no family history. So they said, it's probably hemorrhoids or something. We'll get you on the list for the colonoscopy. And I had to wait 5 months. So I get the colonoscopy, and then, got the news after. And, it was almost like an out of body experience. Like, this isn't even happening. I didn't believe it. I was like, okay, whatever. It's just like, something I'll deal with. I'll figure it out. I got 3 kids, about to, retire from a career in the military. I'm, trying to figure out what I'm going to do when I grow up. So I had a lot of decisions on my plate, and then this happened. So it was just like the record came to a screeching halt, and it took me a while to process it. And kind of like JJ, like I hate giving bad news. I didn't want to like just constantly. I didn't really want to tell anybody at first because I'm like, all right, this is for me to deal with. I'll figure this out, like I always do. And I just kind of held it all in, and it was once people started to find out, it got a little bit easier. And I hated giving them the bad news, so I didn't mind if like my wife told somebody, and then like but when you're talking to somebody and they're like, "Hey, what's up, man? How's it going? How you been? Oh, you must be great. You getting ready to retire and all that, yeah, all this exciting stuff." I'm like, "Yeah, I got colon cancer." What? And it just like sucks the energy out of the conversation. So all that stuff was pretty difficult to deal with.
When you were having those conversations, did you feel like you were burdening people by telling them?
It was like ruining their day. Like they're hearing bad news, and I already know it, so I've already kind of started processing it. Now there were some people who I immediately thought of that I wanted to tell right away. So I have the being fortunate to be good friends with a few doctors, and one is I was his best man at his wedding, so I texted him a picture of the colonoscopy results, and he's like, "Is this you?" Like, oh shit. And his wife's an oncologist, so immediately I had pretty solid information. But it was everybody else, like people in my social network, my family. How am I going to tell my parents? I didn't know anything about it, so I had to research. I felt like I owed somebody an explanation, or like, well, how did this happen? What, like, it didn't run in my family, and I had a lot of questions. So, yeah, everybody was kind of treated differently, but generally speaking, there was no easy person to give this info to.
Yeah. And that sounds like a lot on your shoulders, and this kind of leads into some of the other questions that we had. One being, I think as men, I certainly grew up in an environment where I was told to foster resiliency and that, tough it out, grow a backbone, man up. I grew up with a bunch of brothers, and showing weakness around those environments, it doesn't really help you. And I think I felt a lot of pressure to be strong in situations that I was feeling vulnerable. I'm wondering if those feelings transferred over, and particularly, Bill, with your experience in the military and military leadership, did you feel like it was challenging to open up about this stuff? Did you feel like you needed to live a certain persona of being strong and in control? Because I feel like when I look at you, when I hear about you, I think of a strong and control guy.
Well, yeah. So in military aviation, I'm just retired from the Navy. So naval aviation is the world I know. We call it healthcare aversion. Like going to your flight surgeon and telling them something's wrong could cost you. Could cost you time in the cockpit. Could cost you money because we get a flight pay. We're financially incentivized to be healthy and fly. So when you have information that could prevent you from doing that, like you're scared to tell anybody. And also you're just, we're in a culture, we got type A personalities, people that just, wired to just get the mission done, to lead, to not really show any weakness. And, you couple all that with, cancer in a place that's not somewhere we talk about that often, like I've got a problem with my butt. So I turn that into humor where I was kind of venting, to like, as I was sharing it and try to lighten up the mood. But like deep down inside, there was, I was still like looking at what's the worst case scenario, Googling statistics. I had lost friends or people that I knew, acquaintances from colon cancer while I was battling it. So feeling even some survivor's guilt. It seemed like day by day, there'd be some days were pretty good and then some days were awful. But it always was like, I just tried to, be stoic about it. And when people said, "Hey, you're looking great," I took that as a compliment and not like, "Oh yeah, well, if you only knew how I really feel." I tried not to go down that negative path and try to keep a good positive outlook.
When you had the emotions of confronting your own potential mortality, which anyone diagnosed with any stage of cancer does, because there are, the statistics for any stage are not 100% cure. And when you were navigating that internally, what did you do? How did you cope with that while you were kind of demonstrating control externally?
Well, there's something that I feel that, a benefit of my training is we learn compartmentalization. So if you have something on the ground that's very stressful, you leave it on the ground. You don't bring it up in the air with you. So you walk into your mission brief, your flight planning, that stays outside. So I had already learned how to like compartmentalize things and keep them, outside so I can still function because I'm still working and do my job. But there was a time, I had a 2-week window from when I found out, when they found the tumor to when I got the official diagnosis. In my mind, that was way too long. I had to live with that. And in that 2-week period, a close friend of mine who I had spoken to the night before told him what had happened. This is what I'm dealing with. He's like, I have heart issues. I got to go talk to my cardiologist. You've motivated me to go finally talk to a doctor. Died of a heart attack the next day. Totally, pardon my French, fucked me up. Like I sat in my house just like alone with these thoughts. Like I'm not going to any funerals. I don't want to even think about dying. And it just was like, it seemed like things early on were just piling on. And here I am trying to keep it all together. But no, there were a lot of times where I just needed to be alone with my thoughts, listen to some good music and just kind of like drift away.
Jeez. Yeah, that's a remarkable story. And, we have to, confront our own mortality in this kind of theoretical way when you have a diagnosed and maybe, but then to talk to someone who passes away of a known health risk in front of directly in connection with you, I can only imagine what that did to your psyche. And you had mentioned something, compartmentalization. That's something we certainly do in medicine. But JJ, when I've heard your story before, it sounds like you did something very similar.
Yeah,
Is that right?
I definitely did. I tried to leave all of the bad stuff or all the like stressful, anxiety driven things at one point and then go on about my life in the way to deal with the cancer. So for me, like when I first got diagnosed, I had a friend or say it as like cowboy culture from kind of what we grew up in, or like I no military experience, but I grew up playing sports. So on a team, it's like if you're not injured or you're hurt, you can still play. You can go through it. You can man up and like get through anything for a little bit. And for me, that was like my whole mindset when I got diagnosed. I was like, I can get through 6 months of anything, no matter what the weight of it is, the burden of it is. And as I was going through that, that's when I really started probably compartmentalizing too much because I didn't have to like go to a job or anything. I was just compartmentalizing things because I didn't want to deal with it. I didn't want to deal with the fear or the stress or the anxiety. So I put that over there and I was like, I'm going to put a mask on and I'm going to be like, I can show up and smile while I'm at treatment or go through surgery. And then I think that just kind of put more of the burden on me overall in the end.
Yeah, I feel like as there's something in male culture to push through these things, and I've certainly been guilty of this in my own personal challenges where you push through and there are negative potential, there's negative consequences, and you're like, as long as I don't think about that, and you just do the next things, you get through it. But to a certain degree, that is just being in denial of what can potentially happen, and it can make us not adequately prepare or not adequately kind of attack our problems. Was that the type of compartmentalization that you were experiencing, that it was truly denial, or was it kind of appropriate and allowed you to tackle the problem in smaller, more manageable bites?
At the beginning, I think it was, appropriate and it allowed me to, attack and go through what I was needing to. But over time, it got to where I was just in denial and not wanting to deal with it. And then I experienced like that wave of coming and crushing me when it all did catch up. Because like no matter if you deny something or just don't think about it or kind of put it behind you, if you don't deal with it, it's going to come back to you. And then it's going to, for me, like in my experience, when it came back and like overtook me there, it was a lot tougher than it would have been at the first time. So I had to go through that whole process of understanding that and having that happen before I
In
could
what
totally
way
deal
was
with
it?
it.
In what way was it tougher?
I think it's just tougher because it just like it hit me harder. Like the anxiety, like if I'd have dealt with like the dread and the anxiety and the fear at the very beginning instead of being like, nope, I got to be tough and smile, it wouldn't have been so bad. Because when it all caught up to me is when my cancer came back. And then that just added a whole nother kind of fear because I put it all behind me, got through the 6 months, not in the most healthiest way, definitely not in the most like healthy mental way. But I was like, okay, I've got it. They said I'm, finished chemo, cancer free. And then 6 weeks later is when it came back. And then it's just like everything overwhelmed me. And like that fear that I felt the first time was like multiplied by 10 this time. And there was no running from it.
Well, because in the beginning, you were diagnosed with a curable stage.
Yeah, it was
And
stage
then
2 in the beginning. And then it came back and metastasized. And you're like incurable stage 4.
So it sounds like, as you were, correct me if I'm wrong, but as you were going through the treatment for stage 2, you were compartmentalizing, let's just get through this, put it all behind us. And the idea that this may spread wasn't an idea you were humoring.
It didn't even cross my mind because everything in my doctor, the surgeons are like, all right, we're going to cut it out. You're young. You're going to do good on the chemo, even though the chemo sucked. But I was like, I can get through this 6 months. And then I was like, all right, I'm going on a vacation to celebrate. I'm going to start back to work and, have a whole new outlook on life because I just, beat cancer at the age of 27. Looking back, it was just completely the wrong way to do it because now I know because of friends and other people that even if you're done with chemo or you're done with cancer, it's still going to impact you in ways. But I didn't have any of that like mindset or outlook. I was just like, I'm going to be done, move on, and deal with the rest of my life.
Yeah. Bill, do you think that was a similar compartmentalization tactic, or when you were, or did your military training maybe prepare you to use that tool a little more, let's say, healthily or effectively?
Yeah, it definitely did. And here's my but wait, there's more moment. I always feel like a salesman when I remember like the things that were going on in my life at the time. So I get diagnosed, and not soon after, my wife really just was not handling it well. And it wasn't as much as like, oh, how do I support him? It was like the fractures in our lives were starting to really break apart and widen. And, a few months after I was diagnosed, she was diagnosed with depression and anxiety. So I was on this journey alone. And I'm fortunate that, in the military, my old squadron buddies were all checking in on me. Word would spread pretty quick. My whole first squadron came out and spent a long weekend with me while I was on chemo. Downside of that is every time somebody walked in the door, they're all excited. They got a case of beer. And I'm like, I can't touch the stuff, like. But I ended up I learned so much from that experience. So I learned from, losing a friend while I was waiting from diagnosis, on my diagnosis. I learned just how like resilient a person can be and that we're built to do hard things. And it was like a quote that kind of, it didn't sink in as much early on, but it really resonates with me now, especially looking back, is things don't happen to us, they happen for us. So I kept viewing all these things because they were piling up. And when I was trying to help my wife go through her issues while I'm on chemo and while the cumulative effects of chemo were building up, it was like, okay, things were just getting harder. We had a shooting in our neighborhood really close to right in front of our house. So not only did we had the family things going on, we had external things going on. I got 3 kids. They're spreading out further in the neighborhood. So we moved. And, I would tell my care team, this is what's going on. And they were like, wow, okay, you are under a lot of stress. So going back to the compartmentalization question, there were times when I was on deployment, maybe getting ready for a combat mission, and there were things that are going on that you can't control while you're in the air and while you're flying in bad guy country. So I use that same training and that same mindset to be like, all right, control what I can now. Some things are just going to have to wait. And if it's a treatment day or something directly related to my treatment, I'm going to deal with it. If I have the energy to deal with other things, I will deal with them. if I can't deal with them now, I don't have the energy. They're just going to have to wait. And I just learned a lot about myself, and I learned that, um, you know, like yes, cancer sucks, but there were some gifts in this where I really learned like what I'm made of and what I can handle, and that helped me, and it still helps me today.
So it sounds like the military approach to triaging when you have way more than you can handle. It sounds like you really triaged your life, but that there is an order to that. Is that right? Or
Yeah, yeah. It is. Yeah, it is like a triage situation, right? It's like, okay, look, let's look at the most wounded here. Who can we help? Who's not? What can't? What's not worth focusing our energy on right now? Just to be blunt, and like you have to make pretty hard decisions. And what I learned is that if something was really sticking with me, and I just kept thinking about it when I went to bed, and I was up all night thinking about it, and I think about it in the morning, like I didn't want to move, but I realized like this was this was something that was going to happen and we put it off. We were going to move anyway. And then because of cancer, like all these things in our lives that we had decided we just put off. And then I realized like life goes on, right? And I still have three young kids that I need to make sure that they're safe. And that when I'm laying on the couch, all, just in that chemo shitty place, that I don't really want to be worried as much about them. And so there were just things that like I realized like, okay, I can still make these decisions. These are things that I can work on now. But yeah, it was like if there was something that just didn't need all my focus and energy, I just like the other quote. This is a good friend of mine. He's like, "I bless and release what does not give me peace." At first, I was like, "Man, that's too cheesy." But then I found it like it's really helpful. So if there were things that I just did not need to focus my energy on right there, it's like just shoo it away, deal with it later, and triage the most critical things right in front of me that needed my attention, and it helped out.
something else you said, another great quote that I hadn't heard before, but I love. Things don't happen to us; they happen for us. And did I say that correctly? That's the
Yeah.
correct one. Yeah. So things don't happen to us; they happen for us. I like that a lot. And one thing I've struggled with in hearing patients navigate is how do you find meaning in something that is this tragic? How do you look at potentially your own mortality and somehow make meaning out of that? Was the KFG project your way of doing that, or maybe you can elaborate on what that quote means for you?
Yeah, absolutely. So these quotes that I keep bringing up were from a friend of a friend introduced me to a guy he's a breathwork instruct facilitator, and he's a life coach for Division One athletes, NHL, NFL, like professional athletes. So he's a life coach for these guys. So he's high performing people that he's working with to deal with their own daily stressors that are much like the stuff that we deal with. So I meet this guy and he's giving me these quotes. And I'm like, oh, this is pretty cool. So we kept meeting. I'll give you the abbreviated version. I get into a little bit more later, but I liked it so much. I was like, I think I can do this. And I started seeing instead of me sitting in the Pentagon, with a suit and tie, like writing, making spreadsheets and PowerPoints, for some or working for a defense contractor, I was like, I can turn this what is it, another term, pain into purpose, right? I can take this situation and I can coach people, maybe executive coaching, take some of the military stuff and the cancer stuff and put it into a good story and help others. So I enrolled in a life coaching course, and now it's come to where a lot of these coaches that I trained from or I trained with have joined this organization. So it's KFG, keep fucking going, is they're professional support coaches, and then we just pair them with patients and caregivers. Caregivers, because me sitting in the waiting room, usually the people that are the most vocal of like what the f is going on aren't the patients. It's often the caregivers. So like they need help too. So I pair them up with a coach, and we give them a year of coaching, or however they get the 50 sessions. They can do bi-weekly, whatever they need. But now they have somebody who can connect with them at the soul level. I didn't have a coach that had cancer or was in the military, and it was highly effective. Just a good person to kind of walk that journey with you, and that's basically what KFG is.
Yeah, I mean I think that's great. And I've as a provider, I've cared for a lot of men, a lot of women, and I will say that there is a big difference in the social groups. The men, I mean, there I know good share of guys that couldn't tell you what they're on. So they're there with a spouse or with someone else who's really the one that, forced them to come to the doctor in the first place. And when they have a pain or something, it's really the other person that's like, you need to go take care of yourself. Um, but I think it speaks to that. Maybe the cognitive dissociation, we'll just get through it. What'll happen will happen. And our ability to, really bite into the things that scare us that you can't just push through, you can't just fight through. You need to embrace, you need to understand, you need to cope with. Um, a program like KFG or something that meets you where you're at to help navigate that is critical. Um, one question I have that I think is great for the both of you. JJ, you were young, healthy guy, athletic. You were an athlete, and Bill, you were in the military. You're both pretty masculine dudes, much more than the nerds on the other side of the academia here. So I'm curious. You were diagnosed with a cancer, which is when someone's diagnosed with cancer, it's not something they have a lot of control over. You're not going to out bench press cancer. Like it makes people weaker. You go through chemo. Like it's very vulnerable. It makes you physically vulnerable. I'm wondering how that affected your self-identity, the idea that you had for your own masculinity. What changed? Maybe starting with JJ.
Yeah, it changed everything for me because, as I said, I was 27, so I was 4 years out of being a college athlete. And then I kind of got out of shape, and then I went hardcore back getting into shape, and then that's when I got sick. And my whole life, I grew up, playing basketball, running track, football. My family, my dad and my uncle are Division I college football players. So my whole view of masculine was pretty much an athlete, football player, and everything. And I was, one of the best around here at that. And then to get cancer at that young, while everybody else that I'm, friends with or seeing is kind of getting into that more post-athlete, matured kind of masculinity phase, going to the gym, working out, just kind of what the culture is. And then I'm like, well, I'm going to get chemo. And then I'm like, I barely can walk from my bed to the bathroom for one out every 2 weeks. So it just totally flipped everything that I thought about myself, like a complete 180 of am I really as strong as I thought I was my whole life? Can I deal with all of this? And then kind of that body dysmorphia and kind of affected my mental health of me looking in the mirror and used to could see, muscle definition. And the weirdest thing about, when I was on my first treatment, they were giving me steroids. So it's I would feel so weak, but then I'd be swollen up too from the prednisone. And I'm just this is making me feel fat and weak at the same time. And so it's just a total mind fuck really, because I was the only thing I'd ever really seen in cancer was on TV about you lose so much weight, you lose your hair. So I was well, that's what I expected. And then it was different. And so it just messed it up every other way.
Yeah, and for those listening, when JJ talks about steroids, these are corticosteroids, not anabolic steroids.
Yeah,
so these are
totally
not
different.
the one. Yeah, they do the opposite. They make people feel really weak, and they also prevent you from sleeping.
Make me want to eat everything in the house at 3 a.m.
Yeah, they're not an athlete's friend. And yeah, I mean, as you're mentioning, you were lifting, you had muscle definition. I'm someone, I also lift, routinely, and that's something that's important to me. I boxed for a long time, so I can really relate to this idea that I feel physically competent, like I can, do stuff. I'm a physical person. And as much as I'm an academic person, the physicality is actually pretty important to me. I care about my physique. So I'm wondering if that made you really insecure to lose that over something that you have you can't do anything about that.
Yeah, it definitely did. I would, wanted to wear super baggy clothes there because I didn't want to wear the shirts or something that people could see oh man, there's no more muscle definition there. Didn't want to look in a mirror at all ever because I was just well, I'll look at that. And then I remember me didn't want to look at memories that came up on Facebook or social media or there because I was like, well, am I ever going to be that person again? And it just made me insecure that I could ever look at myself any other way than now. Well, now I'm the guy with cancer.
Did you ever get back to the gym?
Here and there a little bit, but like I'm more comfortable with like my body now. Like I went through that whole stage of like the 14 months where I couldn't eat, where I got down to like 159 pounds. And then that was just like, I would rather be how I was before than, seeing my bones and stuff. So now I'm kind of at that even area where I'm at an okay weight. I still look at myself and I'm like, well, man, I would love to be how I used to look or there, but I'm, it's kind of like, the mental health. Some good days are good and some days I'm okay with it. Other days I'm like, I still don't want to look at myself.
Yeah, and I mean, there's also such a negative trend with male body dysmorphia now too, and it sounds like that almost broke you out of that in a way. Um, yeah, Bill, what about you? I mean, I can't imagine. I can't really think of a lot of guys that more fit the classic definition of masculinity. No, no, don't mean to overly flatter you there, but as military leadership and a fit guy, that's a pretty masculine archetype. Did this challenge that in any way?
It did. I feel like in a way here, I'm also speaking to some of my buddies who know. So I was diagnosed at 45, right? If I was diagnosed in my mid 20s, I think it would have been a whole different set of like emotional and mental challenges. 45 is more like survivor for, for my family. I got kids, I'm living for more than just me, my friends, and my parents. Like, I had to show people that like, I can get through this and be stoic and be be tough. Thing is with me is I kind of joke, but it's like I also mean it. And my friends kind of tease me about this a lot. Like they're like Bill, your lifestyle probably prepared you for cancer and for treatment. So naval aviation is very work hard, play hard, and we deploy, we train. We're always going. We're home for a month, away for a month. When we're away, you're working hard. You're planning. You're flying. You're doing all this stuff, and then you're going out at night. You're hanging out. You're drinking beers with your buddies. Like the camaraderie's there. So and then right up to diagnosis, like I'm still kind of living that lifestyle. I'm living in downtown DC, so I can walk to restaurants and bars. I'm working long hours in the Pentagon. I'm coming home, and these are things that I learned that I was doing wrong back then. Is like come home, play with the kids a little bit, barely make it to practice, drink a few beers, sit on the porch, whatever I'm doing, go to a bar, pass out, wake up, do it all again the next day. And it was not good for just, it wasn't the healthy lifestyle that I had lived previously. It was not sustainable. So I get into radiation because I did radiation. I did TNT, total neoadjuvant therapy. I did radiation and then chemo, rad, chemo, and then surgery. So during radiation, I was expecting it to be a lot worse. And I committed early on, I was going to take the stairs everywhere I went. So I can have kind of like a metric of like how my body was responding. And it was just a way that no matter where I went, I knew if I felt like shit going up and down the stairs, then it's really telling me something of how I'm reacting to this. So I went water skiing after radiation, and I started taking golf lessons. And then after chemo, I went snow skiing. And so I was being very stubborn and not letting go of that. I'm going to do everything that I did in the past, and I'm not going to let cancer get in my way. And now sometimes it was very painful, and it was it didn't come without a lot of need some extra Motrin and just to get by, but it was just those things to say like, all right, cancer, like you're not taking this away from me. So I think that being stubborn and trying to like do everything that I not quit and not say I'm going to give up all these things that I enjoy doing. It helped me. Now I wasn't a Division I athlete. I always wish that I could have been, but still very much into like mountain biking, skiing, snowboarding, like just doing things where I got injured often because I wasn't always careful. And I was just committed to still being able to do all of that. And then, it's just, and then I wanted to learn new things, which is why I always was terrible at golf. And I'm like, oh, I'm not working right now. Golf lessons seem like a good thing to do. And then just the mobility, right? The range of motion. And So I was so stubborn that I didn't want to let go of the way I wanted to live my life, and I was trying to figure out ways to like what's cancer giving me, and it was these opportunities to still prove that I can go through all this. And there were times where it was really hard, and there were times where I was stuck on the couch and all I could eat was like pizza because I couldn't taste anything, and like the side effects were getting to me, but through a period of that feeling sorry for myself, as I started to feel better, I'd go right back to doing something that I probably shouldn't have been doing.
Were there, you had mentioned that despite feeling like garbage, you pushed through and did the things that you enjoyed before.
Yeah.
Was there an activation energy to that? Was that hard to get off the couch and go do it? Or did you find that like it pulled you because you wanted to do those things?
No, there was it took more to get off the couch to go do it. And there were days that I didn't get off the couch, and I try to, "All right, I'm going to binge watch some show all day." But like I just felt like I don't know, like a piece of shit sitting on the couch and doing nothing. I could do it for a day or two, but then I just get that like like nervous anxiety of like, what am I missing? Like I can't be here. I know what's being pumped into my body right now. But it just didn't feel right to sit there and just absorb that. And it kind of came to a head. I had 5 infusions. I just had my fifth infusion, and my buddy calls me and said, "Hey, I got tickets to the World Series." I'm like, "That's great. You live in Arizona. I live in DC. No way." And then I could not shake that feeling of like, what's the big deal? I get on a plane, I fly out there. Uh, it's just gonna look like I'm drunk because and it did. I was like, I called up the next morning. I'm like, dude, I'm coming. I stumbled on the plane, and I remember taking my Cape Cytobine at like 30,000 feet, and I'm like, who else does this? I'm like, this is all part of the story someday when I tell it. The book I'm gonna write that I haven't started, but I get to the game and it was one of those things where it's like the sun is beautiful, the energy of the people around me, and it was just like it was the best I had felt in months. And it's just I'm like, all right, what am I learning here? Like, don't just keep effing going, right? Don't give up. You can still live your life, and however long or short it might be. But I didn't want to miss those opportunities to do great things. And it gave me that little spark, that little energy I needed. And I would think back to that if I later on when I needed to get off the couch or just get up and do something or just say yes to something, because the benefit of saying yes to something usually outweighed the feeling I had in that moment where like, oh, thank God I didn't do that, and I'm just laying around here because this feels better right now. But it never felt better later on.
Yeah, I love hearing that. I mean, the taking chemo on the plane, I have palpitations about being the overhead doctor called, and which I've done, I've answered those calls before, and you
Oh,
always ask, what are you on? And you're like, I took chemo 10 minutes ago. You're like, okay. So if I
wow.
have I heard that, that would yeah, that's a plane that's getting close to landing. Um, but the sentiment that you had, which is like you feel like garbage, it's really hard to get out of bed, to get off the couch, you're tired, you feel weak. And I always encourage everyone, push through that as much as you can. And I've had patients ask me for handicap stickers so they can park closer to places. And I'm like, not going to happen. I want you parking far away, because the more active you are. I mean, if they need a handicap sticker, they get a handicap sticker. I'm not. I don't want. I'm gonna get
Doctor here.
the lawsuits coming. Um, but no, it's like well, they'll ask in anticipation that I think I'm going to feel bad. Can I park closer? And I was like, when you feel bad, I really need you to push through that, because to your point, one, you're going to feel better having pushed through it. I'm very confident of that. But two, the outcomes for people, like they do better the more active they are. Muscle loss during treatment is not a good thing. You do feel weak. You need to make sure your muscle is maintained. So pushing through that, not only I think is psychologically good and necessary, but it also helps people live longer, live better, do better with their treatment. So I think that's important on so many fronts.
I want to pile
Yeah.
on that, and that's why it was so important to me. And this is what my buddy's wife told me. She's an oncologist. She said just you have to stay active no matter what. You've got to, even if it's just walk. So we got a Peloton bike, and I was riding. I was still exercising through radiation. I didn't in chemo. I just walk around the house and I walk around the neighborhood when it really got rough. But I would still, if I'm at the hospital, I'm taking the stairs. I'm parking. I parked far away intentionally. Now it's a military base and parking sucks. I got treated at Walter Reed. They have their quirks, and parking is awful. So I walked, and just like the water skiing, the snow skiing, like looking back, when I think chemo, I don't think of the laying on the couch feeling like shit. I think like, holy cow, I went skiing right after I finished my about a month after my sixth infusion and before surgery. So yeah, I was, and it hurt, but like that, being able to look back at that, even the next day was like, what are you, crazy? But like, okay, this is like, throw anything at me, life. I can deal with it. And it's just that rewarding, it's like an accomplishment in the face of like awful, potential tragedy, disaster, like the worst news, you're fighting for your life. But like in that moment, I'm still able to do those things. And it's like regaining that stubbornness, but like still holding on to like the life that I want to live. And that was very important to me. And I'm just, it was great. It's great now to look back in that and not remember like all the Netflix movies I tried to watch, but I passed out.
Yeah, I haven't used that framework to help people before, and so you're teaching me something that is really helpful. Where, what are the memories that you want to have over this period, and I wouldn't say guilty of, but you don't want to push people too much, to the point where they're unable to do it. But as the only way to make a muscle grow is to lift to failure. Like you have to push things in order to progress. And for you, psychologically and just getting through this was like, I'm not sure I'm going to be able to do that, but we'll figure out when we get there. It's kind of what that's like. You get to the ski mountain and you're like, well, I'm in the skis and I'm on the lift, so like, let's see what happens. Going down one way or another. I'm just curious to help people who are nervous about those kinds of things. Did you worry that you were going to be able to get down the mountain, you were going to be able to water ski when you were going? Like, were you feeling weak?
Yeah, I was feeling weak, but I knew I had enough. If I had enough strength to go up several flights of stairs, and I knew that the worst of the side effects had worn off. Like towards the end of radiation, I was weak, but I could still get up the stairs. Towards, right after an infusion, I had like the first bite syndrome. I had stopped breathing at one point, sitting there waiting for a prescription. So like I knew that the worst side effects were now diminished. So, and then it was just a point of like the mental physical connection. Can my brain talk to my body and get my body to like respond? And you get it's an adrenaline rush, right? The endorphins are released and you're in that, you're like, holy shit, I'm doing this. And, it feels really good. Then you stop and everything hurts, but then you get back up again and it doesn't hurt while you're going down. So there's that, that kind of give and take. So yeah, I don't recommend it for everyone, but if certainly push yourself to do more than you think you can. And I think you'll find that to be very rewarding when looking back.
Yeah, that's great. I think that'll help a lot of people, and I couldn't echo it more loudly. Moving on, there are a lot of side effects to cancer treatments, and I'm familiar with the regimens you both went on. They're not light regimens. These are real chemo regimens that are harder than many people will experience. I'm curious if there was any particular element to your chemotherapy plan that maybe was hard to talk about to male social groups. Yeah, I'll leave that open-ended.
Yeah, I think a lot was hard for me to talk about because at 27, even like 10 years ago, my oncologist, my cancer center, I guess they were still thinking like in the side effects in terms of like, the average age of colorectal cancer patients is in their mid to upper 50s. So the side effects that they are used to are totally different than what my life is at 27. So me at 27, I was a single guy and stuff, and I just never wanted to have a sexual relationship with anybody there for that first time because I was like, looked at myself, I felt horrible. but that was never talked about to me because, going back and asking them, like once I got more comfortable in my advocacy thing, they're like, well, we never really had to talk about that before because all our patients were in such an age of their life or with their wives there and stuff. So it just never really came up. I'm like, well, that's a kind of a huge part of life when you're 27. And so, and I didn't want to talk about that to anybody because I felt embarrassed. I felt like, how can, me at 27 not even have that urge in my life anymore for weeks or months at a time. So that was one that made me like really like have to look at myself and like deal with those inner thoughts. And then it was just like, I hated talking about the fatigue. Like, I'm like, 27 and I'm struggling to, like as Bill was saying, through chemo, I like to go on walks. Like I would go down to my old middle school, walk around the football field on the track. At 27, I should be able to walk a mile at least, at the very least. And I'll get a lap and I'll be like, I'm feeling okay. And then I couldn't even make it through the second lap. And I'm like, okay, this is embarrassing to me. So I would never talk about that.
Yeah.
So it's like those two things is just kind of how I was like the hardest things for me to even discuss to anybody.
I think the sexual dysfunction particularly is one that as providers we don't talk about as much. And I think the reason for that is the amount of time that you have with a patient is pretty limited. And then you're like trying to get through all the things that might kill you. And
yeah, totally understand that.
But, I mean, sure, but that's not the end of it. And I think we need to do a better job of talking about those things, because you had mentioned being a young guy, but having a libido throughout guys' life for their whole life is pretty important. And
yeah, definitely.
And I think there's a lot of I'll say male identity that's wrapped into that. In any relationship you're in, like that's important, I think, for everybody. But that has gotten more, I would say, vocal traction in a lot of the women's cancers, where they've started to talk about it more. And even as providers, I think we're trained probably a little bit better to talk about that with side effects for women. But I don't think we're doing as good a job with men.
I've seen some growth in like my advocacy and like doing stuff and like some growth, but it's still not being addressed enough. And it's like different because it's got to be addressed different to men, to women, to young people, to like the certain ages, because everybody's looking for something different. The quality of life and the sexual health of a 27-year-old is going to be different from, other patients. And so I think it's just, sometimes I think people want one streamlined answer on how to talk about something, but that's never going to be the case in, the broad spectrum of cancer patients.
Do you think part of remedying that is having a more comfortable relationship with your oncologist to bring things up? Or should it be brought from the oncologist to say, here are other things you may experience, although, they're less likely and they're not as severe as the life-ending things? What do you think?
I think it's a process. I think it always should be brought up by the oncologist at first, because most cancer patients, like, I never knew that was going to affect my, urges or my sexual or like any of that. Yeah. But then I think it goes on to how comfortable the patient is with the oncologist and kind of goes from there. So that in the perfect world, that's how I think it, should work.
Yeah, that makes sense to me. Bill, what about you? Any side effects of cancer treatment that were hard to chat with your friends about, or, particularly uncomfortable?
I think for me, you're married, so everybody assumes that the sexual side is just fine. And, but yeah, there was when you're getting pumped with poison, that's saving your life. For the first time ever, it's like, oh, those thoughts don't really cross my mind right now.
Yeah.
But it's as you reemerge, right? And then you realize that, I'm gonna beat this. This is good. Like, I think that when you're healthy, at least for me, those thoughts came back. What I was most freaked out about was the incontinence. And at first during radiation, you get like the weekly check-in, and they're like, hey, any incontinence issues? Like, no. And then I remember like the next time I came back, I was like, God, I shit my pants leaving a restaurant the other night. And it was like, okay, that came on fast. And then I'm like, all right, now I'm starting to realize, okay, no, there really are, so I flew a jet that we're an electronic jammer, airborne electro. We're shooting radiation to like radars and things and shutting down things and shooting things, right? So I just imagine, yeah, I'm like laying on a table getting the same radiation, not the same, right? But very similar in it, to that your pelvic region and like the area of probability of that this is causing damage is pretty large. And I started I started feeling that, and that's where the incontinence stuff kind of cascaded into chemo, and then after surgery I was on an ostomy bag for 6 months, had a reversal, and then immediately after that was just devastating, like running to the bathroom 30-40 times a day. So, and now I had a lot of organs removed, so I don't have a rectum, I don't have a sigmoid colon, and because of that, it's something I deal with every day now. And that is probably the hardest part, where you just don't like to talk about it. And then if you do bring it up, no one else really wants to talk about it. It's like, we don't like to talk about our poopies, or whatever. Like when you have kids, it's a little bit more natural as a parent. But when it's yourself as an adult, like no one really wants to talk about that. And like I just don't usually bring it up. But that's probably on the bio kind of aspect of this whole experience, is the part that I'm even more stubborn and I still go to physical therapy. I keep asking for referrals, and I go to pelvic floor therapy. Is it healing it? No, but is it helping? Yeah. And it also is helping my core and giving me an opportunity to go work out. And, so that's why I mentioned the mental physical connection earlier. I think when your mental side is stronger and you feed that, then it gives you the almost like mental and intestinal fortitude to work on your body and make sure that that's strong too. And then through all of that, you feel the benefits of that hard work. Like when you're sitting around, like right now, I worked out this morning, like my shoulders hurt. It feels good. And I feel like fortunate that I have the opportunity to still exercise and maintain a healthy lifestyle and keep up with my kids who play 6 sports. Because I didn't give up and I didn't want to just sit on the couch and just let life pass me by.
I think that makes a lot of sense. And the challenge of talking about the side effects, particularly with colorectal cancer, and males also get prostate cancer, radiation to that area and surgery in that area is not comfortable. There's a lot of side effects. With that comes erectile dysfunction and things like that. But I think a lot of the cancers that tend to occur in males are in anatomic regions that are hard to talk about. I'm fortunate as a provider in that I treat lung cancer, and people are pretty comfortable talking about the breathing. Like that's not a taboo subject. But if you're talking about, bloody diarrhea, you're talking about anal pain, you're talking about, fecal incontinence, like you're unable to control your bowels. These are things that you don't want to, like, it's pretty hard to bring that up with friends. But with friends, you can say, I've been kind of shortness of breath, or, I've been short of breath. I'm coughing a little more than I used to. That's weird. But no one's going to say, I'm having more blood in my stool, or at least it's rare to say that to your friends.
Yeah.
Yeah. Like I'm an oncologist and I've never had a friend say that, but I also have a fairly young friend group. So I'm just curious, do you think that guys cope with not only the symptoms, but also the diagnosis, like just all of this? Do men cope differently than women around cancer? And I guess we'll start with Bill.
Oh yeah, I believe so. We have that. I remember just growing up, my dad never went to the doctor, right? Gets sick, and still, like, no, I don't need that. I can figure it out. And then even in the military, they give us Motrin for just about everything. And, it's like, we always laugh at it too, but it's like, I think, and then I mentioned healthcare aversion too. It's just, I think we just want to be that like tough guy, mentality. And it takes a lot to be vulnerable. I think women, tend to be a little bit more open and vulnerable. I'm right. I'm not a woman. I don't know, but when I talk to them about it, I have a lot of women that are coaches for this KFG project, and I did 7 months of coach training with them, and the things that they were much more open about was it took a lot for me to, to like, all right, I guess I'll bring this up. And it just was like me getting over the mental barrier. Once I brought it up, no one cared, but it was just me, my own thoughts saying, I can't talk about that. And I think that like we grow up, there's things we're allowed to talk about and there's things we're not allowed to talk about, like, socially. And it's hard to get over that. And I think there's a lot of pressure when a guy gets, diagnosed with cancer in one of those forbidden regions that you're not supposed to talk about. You can joke about with your friends, but not like joke in a way of like, oh, I have a legitimate health concern.
Right.
It's harder to get over that barrier, but once you get over it, it's like, so what? Like I have this feeling that I can't talk about this. Why do I feel this way? And if you kind of dig in and just think about it and try to like analyze those thoughts a little bit, you get it. Well, if I do bring it up, so what? If it doesn't bother me, I can talk about whatever I want. If somebody's uncomfortable, then they can move on. But like, I think having cancer or having a health issue gives you a pass to talk about things that you're normally not supposed to. And that's the logic that I use to be more open about it.
I think that makes total sense. And, it's funny. And being a provider and work, my training was initially we do internal medicine and then you go into oncology. So when I was an internist and working in the ERs and everything, you don't see a lot of, I have, seen issues with the different sexes in that not a lot of women want more sutures so they can tell their friend I got this many stitches rather than that many stitches. Or, one of my family members had like a root canal and they said they didn't want anesthesia, like they didn't want the lidocaine. And it's like, okay, like, but that's a thing. Like it's a thing in masculine cultures to say, look how tough I am. And you don't really get anything for that. Like there's no bonus. The cancer doesn't go away faster. Like you just have symptoms and you're alone. Like that's the reward for ignoring it or, having X amount of bowel movements a day from your radiation and saying, well, I didn't talk to them until I had 50. It's like, okay, well, congratulations. Like, you didn't win anything. You just have more bowel movements now. It's really uncomfortable.
I do want to say, I'm
Jake,
glad you brought that up because I cut my hand, 20 years ago and I got 2 stitches. And I remember being like, might as well just give me a Band-Aid. I don't want to tell anybody I got 2 stitches. It's
like this is embarrassing.
Yeah. Like what a waste of stitches.
Yeah. No, it's a thing, but I haven't heard a lot. I'm sure there are women out there who do something similar, but I think it is less common, or at least they don't talk to me about it.
They do have babies though, so they have some trauma in that area, but it's for good, and they can talk about it. It's a license to be more open about that in their own circles. But anyway, yeah, I think I always felt like the colon cancer was like, oh, that's now I can be. I didn't want to be, but when I wanted it, I like to have a sense of humor, and I put a lot of the truth is often spoken in jest. People have told me before, so I'll crack jokes about it. But now I could crack jokes about my butt, and in a way that was helping me to kind of like vent a little bit, but through humor. So it wasn't a direct, this is what's going on, but through humor, I could at least let some things off my chest. And I think as guys, at least the guys I hang around with, we're all kind of similar in that way.
Yeah. And I think, in my circles, people have a sense for picking up, that this is how we communicate and there's actually something real under there. Like you're not just making a joke, like this really is, an issue. I think the circles I'm in, we communicate like that too. You'll make a little joke, but like really, this is like pretty terrible. JJ, what do you think? Differences in oh, go ahead.
I definitely think that their men handle like getting cancer and just everything different than women, and how they cope with it. As we've all said, like most men want to be the tough guy, want to be strong, want to be able to shoulder the burden and not put it on other people. And in my experiences, that causes men more to isolate, and I think women do the opposite. Like not saying when they're diagnosed, but when they're dealing with issues, I think they reach out for help more so they can get through the issue and me as a, like, in my experience, me as a man, I'm like, nope, I can figure it out myself. I'm good. I can shoulder it all there until I, do 10 wrong things to figure out the one right thing to get through. And then a lot of it, I think, is, even if, like, us as men don't realize it, subconsciously from society, we think we're supposed to deal with it this certain way, be tougher, be stronger. And I think that has a lot to do with how, looking back, it has a lot to deal with how I thought I could shoulder and get through everything, even though I didn't know that was why I felt that way.
Yeah. So you felt like there was I guess, a social norm, or, you were trying to be what
Yeah.
you feel like you're supposed to be.
What Yeah, I was supposed to not complain. I wasn't supposed to sit there and, whine about this hurting or that hurting or everything I was going to have to do. I was just supposed to get it done, do it, and, kind of bow your head down and get through whatever's in front of you. And definitely not the right way to do it. And then going back on that other thing, I was probably the same kind of, back in the day, be like, oh, you can put another stitch into there, or why even do that? Now I'm like, you can give me double lidocaine or double anesthesia, be like, you pour it all on.
Yeah. I think it's a better tactic.
Yeah.
But
Definitely.
I think you're right. I think there's a kind of a social reward, I guess, maybe, to being the stoic person who goes through. And I would even say that when I hear stories of people who go through something really hard and they don't complain and they push through, like, I still do idolize that. Like, I still do see that as a positive thing. Although, being in this field, I've learned to value that, to address those things and to face something head on sometimes does require being a little emotionally connected. And because you can't adequately address problems that you're not willing to understand. And when you're diagnosed with a cancer, you have to humor and intellectually cope with negative consequence. And to be in control means to internalize that and to say, okay, these are the potential outcomes. What do we do in these situations? And maybe not all at once, to Bill, to your point, like, we have to triage, and we have to, deal with the things acutely that we have to deal with right now. We don't have to worry about a, 5, 10, or 2-year plan, right now, but at some point. And I've learned that that's a virtue of strength when I see people doing that. So I think even through my experience in my medical training and treating patients, what I've learned to view as a strong individual has probably changed. Do you think that view of what strength looks like after going through this process has changed for you? Maybe starting with Bill.
Yeah, I mean, it always for me goes back to that Jim Valvano speech on the ESPYs, in the '90s, where I think he died like a few weeks later, but he's given his, the main thing he said was like, don't give up, don't ever give up. And that, like, I remember watching that speech while I was on chemo on the couch, and I just started like bawling. I'm like, man, like I can, that guy's up there talking, and like what we know now is he died like soon after. It's like, no, I have the opportunity, like my chance of survival was much higher than his. And I realized, like, all right, I have the opportunity to kick the shit out of this and then come and then use my story to help other people. And I think it all just goes into like, not giving up and not, I don't know, like, what's that cheesy song? It kept popping in my head a lot. I get knocked down, but I get up again.
Chumbawamba. Yeah.
Yeah.
Tub thumping.
Yep. Yeah, so that would pop in, and then always one of my favorite movies, like Shawshank Redemption. He said it a few times, like, get busy living or get busy dying.
Yeah.
And I'm like, all right, well, the moment I give up and let this kind of defeat me, like, I'm basically on that dying path. Mm-hmm. So I have a vote, and at least for right now, it's going to be to continue to kick ass and right now, just fight, give everything I have, and learn from it, and not just emerge. This is the thing that drives me nuts. This is the hardest thing for me to see. I'm in some other groups, and I see people that like beat cancer, finish treatment, and they go back to living their life the same way they were living it before. Now, maybe it's a little harder, right? You're in your 20s, and you get diagnosed. Like, I don't think I would have responded the same way. But, in my mid 40s, I'm like, all right, I don't need to go out and have a bunch of IPAs, on a few times a night or a week, just to cope. Like I can, I'm going to tune in and address things internally instead of tuning out. Tuning out is drinking and just, so I just learned like a lot of different things that I think are going to go into my overall survivorship and resilience. And, they're just they're gifts that I got out of this, realizations that were right there in front of me the whole time, but I didn't really pay attention to. And I think that just all goes into, not giving up and just continuing to just, keep on keeping on and, not end up on the infusion table or the operating table if I have anything to say about it.
Yeah, I love that mentality of essentially growing through this, not just getting through it, but how do you improve as an individual and use these opportunities to help other people? When I was training in cardiology, in my internal medicine training, there was a sentiment which was like, I want this heart attack that you live from to be the best thing that ever happened to you. Like this is going to be the thing that changed your life now. Before you were eating like garbage, you were drinking, you were smoking, but because you've had this heart attack and you realize that all those things are bad for you and can end your life at any moment, you're going to change those things now, and your next however many years, we don't know, but they're going to be good ones. And how do you and it was easy to inspire people with that because one, they were living through the heart attack, and a heart attack is a big life-changing event. It really does scare people, and I think it does motivate people for positive change. It's harder to do that with cancer because it's often not lifestyle associated, like it's just a bad hand. And I think that's a much harder thing for people to cope with when you didn't do this to yourself, but through whatever means it's at your door, and you have to do with it what you will. It's not going anywhere whether you earned it or not. So it's tough to inspire people to make those positive changes. I mean, what would you say to the people that are in that mentality that this isn't fair, I didn't do anything to deserve this? How does someone get through that for positive change?
I got an answer that helps me. So everything is information. You get a heart attack, that's information. Your body's trying to tell you something. You get cancer, whether you had anything to do with it or not, it's just the luck of the draw. Your cells mutate for whatever reason. Hey, it's you. It's information. So what do you do with that information? You can ignore it and say, "Woe is me." I wish I was like all the other healthy people that I see posting pictures on vacation and social media. Well, that's not you. So you have to own it and use that information to decide what you're going to do next. And what you're going to do next, if you're talking to me, is going to be, let's get to like, how do you reduce the chance of this ever occurring again? What I love about, I read a bunch of, stories of people that beat cancer naturally, right? And people were sending me those videos when I first got diagnosed. And I just love like at the very least, they've made very conscious decisions and and lifestyle changes to be in, whether they're successful or not. I don't care. What I like is that it's information that I can use in my mind to reduce the risk of recurrence. Now I'm making healthy, changes in my life, but I just look at it as like, just if I try to distill whatever's happening to just, all right, this is information. How do I want to process this information? What's my body trying to tell me? What's the environment? What's whatever's, it's like you're driving down the road, somebody darts out in front of you. There's some information. I'm either going to jam on the brakes or I'm just going to hit the gas and kill them. Like, like how do you respond to that external stimuli or, the information of a diagnosis, whatever it may be. And then I just try to look at it very simplistically as like, what do I do with this information? And I think that can apply to any situation, any shitty situation, even to a bright young, budding NFL star that tears his ACL and MCL and has a catastrophic knee injury on the field. Like, hey, sorry, maybe you weren't meant to be a player, but you can use your story. You can be a coach. You can do other things. Like, just try to look at it as you're still here and you still have a chance to use this information to make a decision and try to, you're on this earth and the chances of you ever getting here are very slim. So you might as well enjoy while you're here and do something good.
Yeah, I love that. carrying on here, I'm curious. You've talked about how do you take that mentality or the bad situation, I'll say, in your case, cancer, in other cases, sports injuries, heart
Shit
attacks, what
sandwich.
have you.
It's a shit. How do you eat that shit sandwich? Sorry, I couldn't resist. That's how.
Yeah.
Yeah.
So we've learned, I have some thoughts on how to progress from that. What are some, I'll say, unhealthy coping strategies that you had or other people in the cancer community have had that, maybe acknowledge that these are inclinations that people want to do this and, get it out there to help people move on and get over it, not lead into those coping mechanisms.
Unhealthy coping for me, it was just, avoidance. Like I just wanted to avoid everything. Isolation because I didn't want to bother people. But I know a lot of people that I've met and stuff have turned to, drinking too much. I've known people that never really drank before their diagnosis that started drinking afterwards just to numb the, anxiety, the thoughts in your head, the pain or addiction. Because I can't name the statistic off of there, but I've heard it enough to say like there is a high statistic rate of people not diagnosed at different ages of cancer that turn to addiction just to deal with the overwhelming pressure. And I think just, it's going to be different for everybody of not how not to go into those avoidances and there. But I think for me, it all goes back to not isolating and not taking it all on yourself. And to go, I mean, the hardest thing ever, is to ask for help and to ask for help there to get it and then just kind of learn from there. And a big thing for me was not to deal in like absolutes. Like just because I didn't change everything in my life doesn't mean I'm still doing a bad job. Just because I didn't become like the perfect kind of, health thing that you see online. But I still, started walking more, ate a little bit better, cut out a little bit of this. I am doing a good job. And I think when people can start seeing it in that way, you get that, little, dopamine boost of like, yeah, I am doing an okay job. I am doing improvements, and it can keep moving from there.
So it sounds like, don't isolate, don't mask with either isolation or alcohol addictions, and then compare yourself to yesterday, not, 10 years ago, 5 years ago, and you'll see improvement. Bill, what about you? Any unhealthy coping strategies that you've experienced or seen?
Yeah, it's all the stuff JJ mentioned, and it's always it seems to go into that isolate, use hide in a crawl in a bottle, and I like to I just you like to generalize it into like tuning out instead of tuning in. Not to plug the band. There's a great Pearl Jam song called "Given to Fly," and he could have tuned out, but instead he tuned in, meaning like something bad happened. How do you respond to that? And there are the unhealthy ways to responding to it. Just isolating, being just like it's lowering your vibration. We have this like we're all energetic human beings, and if you lower your energy and your vibration, and you just give off this like I don't want to burden anybody. I don't want to, it's those that isolation. I think that's as social beings that makes things worse, and I've seen it, and that's what a lot of things. As I've talked to fellow patients, as I was kind of working into this building this KFG thing, of sensing that's happening with somebody and just talking with them through it, and then realizing like I can take the things that I had, which was the connection, right? Meeting a coach, have my friends, my social circle, had a great therapist at Walter Reed, and have encouraging people to like reach out, like don't whatever that thought is that you think you need to isolate, like let's work through that and talk and just get things off your chest, process things, don't bottle them up, try to release things, and I think that's one of the things that would help at a very very minimal would help so many people if they just were more open about what they're dealing with.
Yeah, and following up on that, I'll say, as a healthcare provider, there are a lot of instances where I'm interacting with a patient, and this happens, men and women alike, but probably more often with men, where how are things going? Yep, it's good. And I've been on the other side where it's like, yeah, I don't want to get into it. As a patient, like little things, yeah, we'll see if it gets worse. And people don't want to bring things up. I'm curious if you have thoughts about how providers can help push through that. And when you're in a dark space and when you're, feeling crappy and you just say, yeah, I'm fine. Like what can the provider do to better connect?
For me, like I notice I'm doing that at times because I'll fully admit I do that. Sometimes I'm just in the I'll be like, yep, I'm good. If there isn't something that's like crazy out of whack from, my almost 10 years of this, I'm just gonna be like, I'll talk about it next time or there. And I think to a while that's almost becomes like fatigue of answering the same question, or like I don't know if it's different at every cancer center, every hospital, but every time I walk through the door, I get the same forms to fill out and the same things. And I'm just like, after a while, I'm just like, check, check, check. Don't even read because I'm like, okay. So I think just finding a way to not get that fatigue of it. And I know, like I said, I might be a little different because I've been doing this for 10 years every 3 weeks. So I know that's a long time and I've seen a lot of forms. But then I think more just, and I know the time constraints is very hard on like oncologists and nurses and stuff because unfortunately there's so many people there, but more just like one-on-one dialogue. Because I've been at some times where they just look at the paper and they're like, okay, you're all good, blood work, temperature, nurse will be in here in a minute, the oncologist will be in, talk to them, and you're out. So just maybe more open dialogue I think would help a lot, because as a patient it's like you're actually talking to somebody and not answering a question on paper.
And when you say open dialogue, what does that look like for me? I mean, I'll often get into something that the patient, will talk about sports teams or something. I grew up a Patriots fan. It's harder to talk about. Yeah, I know, right? Yeah. Everyone's got an opinion about Patriots fans, which is nice. Like, it opens a conversation one way or another. But, do you recommend starting with something that's not just like build some rapport, I guess, is what I'm trying to say.
And I think it's going to be different for every patient as you get to, know them over, a couple visits in there. You can kind of like build that dialogue up to just kind of break that ice because every patient that comes in there, they don't want to be there. They don't want to be in the doctor's office. And, like I was talking to somebody the other day. It's like every time I walk in there, the first thing that hits me is the smell of like the infusion center there. And it's just kind of automatically like shuts me down for a little bit. So it's just like something to get back into a normalcy of like, I am a human. This is another human. I'm not just the patient.
Yeah. And it's interesting. I mean, one of the big reasons I got into medical oncology rather than any other field, surgery, even radiation, is the relationships tend to be longer. Mm-hmm. You're not just there for the surgery, you're there for the whole time. But to your point, we don't have something in our system that's like, how do you two start right off the bat and get to know each other well? Like as humans, it's very medicalized, which, I mean, it's a medical institution, it makes sense. But the oncology relationship is a bit unique. It's a lot more vulnerable than other specialties, I think.
Yeah.
But yeah, maybe that's something we need to consider in the future is, when you have a new intake, what's the way to connect more at an interpersonal level?
Yeah, I mean, the first time I met my new oncologist after my original one retired, like the first thing our conversation was, I just like was my tattoos because he's a Star Wars fan and a Lord of the Rings fan and stuff. And that kind of just set the whole like kind of path over the next few years of we'll always talk about that a little bit and then go into my, what's going on with my body.
Yeah. Like who would have thought that those little intangible things, they really do. I mean, they show that you're, that they care.
Yep.
Yeah. Bill, what do you think, pushing past when a patient is just saying, I'm fine, they're in their own funk or, they're not feeling well enough to engage. What can the provider do?
You guys said a few things that kind of struck some thoughts. One, I think the biggest thing overall is it takes a village. So the provider, the team that's helping the patient is what matters most, I think, because if the provider, I've seen, one of my best friends is a radiologist, and I've got good friends that are doctors, right? And they're busy, and they've got a lot of different, and you could always tell when they're real busy, and like there's people waiting outside the door, they're running late, and they're like, and they're trying to type in some notes, and they got somewhere else to be. and I'm at Walter Reed Military Medical Hospital, and the docs had fed 3 different oncologists in a year. So I think like the perfect scenario is, when you want to fly in aviation, you got to take this aviation test battery that includes a personality test. So there's a certain personality they're looking for. I tested it out at first because I thought they didn't want somebody that had been in a bar fight, and but they want that kind of, that at least somebody who's willing to take a risk and maybe be a little aggressive. Yeah.
Yeah.
But like, I think an oncologist should have a little bit more of an empath side than a surgeon, because I remember having to tell myself, surgeons cut. There is no like long-term relationship there, right? They're gonna move, take something out. They're gonna high five their buddies and then walk. Hey, look at my beautiful work. This one only got 2 stitches. So I'm so good. I think like, for an oncologist, you have a different, I think like duty of care in a way that it is a longer term relationship, and you should feel more incentivized to get to know the patient a little bit and have some of the conversations that maybe they might also be happening, or I'm hoping they're happening with a therapist or their nurse or somebody else that they're at least like in that care team are able to open up to, even if like the oncologist is busy and maybe in that appointment can't have the time to really get to know them or have that connection. But they need that connection, they need that trust, because then it'll help, I think, when they want to admit, yeah, there's some other things, or these are the things that I'm not comfortable talking about, but now I have this rapport, and I almost like, it's cancer sucks, but I kind of look forward to having this conversation with this person, with this provider, because I know they care, and I know you get that feeling. When you walk in a room, you can feel the tension in the room, right? Or you can just kind of, so if you feel that this person doesn't suck, and while you're in a sucky situation, to put it bluntly, like it helps. Yeah. And that, I think the personality is a big thing. Like my buddy, the radiologist, his wife's an oncologist. She's great. He'd be a terrible oncologist. He's not. He reads MRIs, right? So I think finding that fit early on is great. And it sounds like you did that and arrived to a place where you can help, and you actually, care and want to get to know the patients a little better, and all that goes into the whole quality of care that I think is very important.
Well, and I think this is a good time to transition and hear about KFG Project, because this is a whole initiative where, when those social needs are not necessarily always being met by the medical establishment, or the medical establishment's limited. And tell us a little bit about how KFG Project bridges the gap. What do you do? What's the mission?
Yeah, so it's this is kind of a blueprint in my journey, where I met the life coach and realized that, like, wow, there is this is someone to talk to that can connect at the soul level and really get to understand you and help you get behind some of those thoughts that you're having of like, oh, am I going to die? Or maybe, why do I have this hesitation to discuss something or work through something in my life? It doesn't have to be cancer related, because cancer just adds on to all the other shit we already have going on in our lives. And it's a pretty big thing, so it sucks up all the attention, especially at first. So I just had this idea of like, well, if I want to help people keep fucking going, I want to give them, at first, like a coach, somebody that can just kind of walk this journey with them. And it's not right after diagnosis. I believe right after diagnosis, and especially what I experienced at first, is you got to process this stuff. And that is you need, if you have the opportunity to talk to a therapist and somebody who's licensed and trained in that, but as you start to emerge and think of like, all right, how do I want to emerge from this whole cancer experience? What does life look like after? What's my purpose in life? What is my identity right now? Am I just a cancer patient? I was somebody who had this life of whatever I did before, a mid-20s, athlete, or whatever. I believe the AYA community has the most ahead of them, and they could benefit from this the most, because they have so much life ahead of them after this. So KFG, Keep Fucking Going, is professional support coaching to patients and caregivers, but it's for my community, right? So military, and that could be active duty or veterans, emergency responders, because they wear a uniform too, and they they have a lot of the same issues that personally that somebody in the military does. But then AYA, because most of the Walter Reed patients are AYA. And as I got to know them, I'm realizing that the AYA non-military have the same, like concerns and thoughts. So I'm like, you don't have to be in the military. You're under 40. We're going to help you too.
And when you say AYA, for those who may not be familiar with the term,
adolescent and young adult. So we were going to give you this kind of partner in this journey, and we have a 3-phased approach that gives you coaching. We're also giving respite retreats. So I had the benefit of doing some trips through the USO, the military support organization. I got to go to Disney. You go to this trip, you feel amazing. You get home, it's like, all right, what's the next treatment thing? Now you're back into it, and it sucks. And I felt really alone. It's like the post-vacation hangover. So we want to give them an opportunity to go away, but then stay connected the whole time. And we're bringing some other, journaling, introducing them to, meditation, mindfulness, yoga, healthy eating, things where, like I said earlier, everything is information. We're going to give them bits and pieces of information throughout this journey, but with an actual human coach that will walk with them through this, and then introduce them to other coaches and other modalities that, as they learn all of this, now on the other side of cancer into survivorship, they have the tools to, what I'm using this for, and that's to reduce the risk of recurrence and to, live as long as possible and be more resilient from everything that I've learned. So KFG is just all of that packaged into, this human experience to give them the tools to keep fucking going.
Well, thanks so much for starting that initiative. And I think you're giving people an opportunity to cope with what they have and, create a support group that's not, that acknowledges the cancer that they've got and the challenges they have, but not through a lens of victimhood, not through just a lens of the why me, which is real. Like it is, I mean, it is a true, people are victims. Like it's not a fallacy to say that, but it doesn't help to end there. So to look at that, realize that, be in that community, but then say, okay, now what? And how do we work together to improve, I think is amazing. And so thank you so much, not only for the military work you've done, continue to do, but then, even in your time outside of that, you're here making the world a better place through KFG Project and coming to chat about it with folks like us. So we really appreciate it. Where should people go to learn more?
Oh yeah, kfgproject.org is our website. We're all over social media. You look up KFG Project on LinkedIn, Instagram, Facebook, even YouTube and X. We're getting some of this, content like this out there. But really, in the websites where you're going to be able, you could apply, you can volunteer if you're interested, and maybe you don't need the services, but you want to help. We have a lot of opportunities. We're growing, and this is scalable to probably any oncology center. Right? We're starting with the military, but as people really start to get in the program, and then we're getting a lot of great feedback already. We've only been we're calling them members. So if you're a patient or a caregiver, you're a member that we're supporting, and the feedback we're getting already is incredible.
Well, thanks so much for all the work you do. And thanks again, Bill Phillips. JJ, thank you so much. Any last words from either of you, starting with JJ? Any things to add before we end here?
No, I just love this conversation. I love the idea of the KFG project. I'm going to contact you off of here because I got some ideas with the advocacy stuff I do and many different things that I think would be a help for both of them. And it was just an honor to be here and have this conversation.
Wonderful. All right. Well, thank you both. For those listening, thank you for listening to Cracking Cancer. You could learn more at crackingcancer.org. Remember to subscribe, and we will see you next time. Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.